different and so good. Okay. Now, let's talk about the famous old scripts of Ayurveda. As Ayurveda is taken as divine system, so never any animal testings were done. First, this information was passed orally through Sanskrit verses or chants. Later on, some sages compiled this information on the leaves, barks, and later on papers. Ayurveda mesmerized the world by its knowledge and unique way of healing through herbs, food, aroma, gemstones, colors, yoga, mantras, spiritual practices, and style improvements. So here it is important to note down that Ayurveda is a science of healing, and it's nowhere related to any religion. No religious activity is ever done in Ayurveda, albeit spiritual growth and love of mankind. After this glorious past, India suffered from many attacks. Many books and literature were stolen and destroyed during attacks, war, and invasions. These days, we can find only Charak Samhita, which is considered as book of medicine, and compilation of oldest book of Atreya or Agnivesh Samhita, book of surgery, which is Sushru Samhita, and Ashtanga Hridaya. So these three are the main books of Ayurveda and called Brihadratrayi. So let us just stop here. Vrihad means big or old, something like that. Oh. Means biggest or oldest, something like that. Means very, very big. Trayi in Sanskrit, Traya means three. So the oldest or biggest three. So these are the three books: Charak Samhita, Sushru Samhita, and Ashtanga Hridaya. So Charak Samhita, as I told you, Charak Samhita is written by Acharya Charaka, and it is mainly on medicine. Sushru Samhita is written by Sushruta, and it is mainly on surgery. And Ashtanga Hridaya is more of a compilation of both of these. But in Ashtanga Hridaya, I find very good information about preventive medicine, preventions, healthy lifestyles. Very nicely they have described. Okay, so these are the three famous oldest books of Ayurveda found so far. And as we are discussing again and again that there were lots of things happened in between. Invasions happened, war happened, and lots of things happened that we lost many things. After this glorious past, India suffered from many attacks, right? So during time of Buddha, main work with alchemy was done, and many metals were introduced with herbs to enhance the effects of herbs. Nagarjuna was the main alchemist of that period, and many books called Nigantu were written at that time. So that was also the golden period of the Ayurveda for the work on natural minerals. But because of no bloodletting and no violence, Buddha, at the time of Buddha, surgery left behind and almost eloped from the Ayurveda world. So now, Buddha period came, and before that, lots of wars and these type of things happened. So we lost many literature. But at the time of Buddha, then there were lots of fights were happening. That's how he became Buddha, because kings were having lots of fights, wars were happening in between. And then he thought that he do not want violence. And he said, no bloodletting, no blood anywhere. So let us do not fight. So because of no violence, so there was no surgery also. Because those days surgery was not very elective. These kind of problems we were not having those days. It was mainly wars. War, amputations, wars, cuts. So these kind of surgical things were happening those days. And when Buddha time came, so no surgery, no violence, no war, and surgery needs practice. We lost the books and we lost the practice. So that's how surgery finished. But now what happened? There was a good thing also, that people will come to the medicine doctor for everything. Even if he's saying that you need a cut, you need little bit of cutting and cleaning, but nobody want to go to the other doctor for cuts, because for the surgeon, because they will say, oh no, I follow Buddha, so no violence, no blood, no blood, no violence, please you treat me. And you are saying I cannot treat because I have herbs. This is not a very strong medicine. You need surgery, but I don't want. Now this doctor has a problem. He needs to make his medicine strong, because nobody wants to go to surgery. Everybody wants treatment with medicine. So they started adding minerals, natural minerals with the herbs, and made the medicine very, very strong. So that was the time when Nagarjuna was there, and you will see in Buddhist scriptures, Nagarjuna was the monk who was practicing medicine at the time of Buddha. And he was the person who started adding lots of minerals, metals into the herbs and make them more strong. So the medicine take a turn, it became more stronger, it was working more nicely, but the problem was surgery finished. Surgery finished altogether. There were no books, no literature, no practices, so finished. But alchemy, yeah, you know alchemy. What is there in Japanese? How you call it? Yeah. Okay. Yeah. So yes, from natural sources. Iron, like copper, zinc, so calcium from seashells. Yeah. So lots of things they started mixing. Yes. So many things, sodium, potassium. So they started adding into the herbs, and they find that they become more strong. So now we have, when we will come to the medicine section, I will tell you how many type of medicines we have. Okay. So that was it for the first part. Now, I just want a few things to tell you, and you will be so surprised. We still have Ayurvedic surgery, one or two things still we have. And when I will tell you how we do it, and what is the comparison between today and that thing, you will be so surprised. So a few things I will show you. There to show so that we can record also. Just okay. We still have surgery in Ayurveda. Few things still was mentioned in the book, and we still are doing it. What is the name of that? I will explain you here. We call it Shara Sutra. And for what we do it? We do it for how we call in Japanese? Z. In bottoms? You know? Okay. Okay. Yeah. Okay, I will explain. So there is a problem which is very, very common when you have bumpy or when you keep on sitting long time. So what happens is, this is our rectum and toilet is here, right? So this area has, this is toilet, and this area has some muscles, and lots of fat. Some muscles and lots of fat, right? Yeah, and fat. So fat does not have blood vessels in it. Muscles have lots of blood supply. Fat does not have good muscle supply or blood supply. Means if there is an infection happen here, it will be very difficult to treat it, right? And here we have lots of glands, oil glands. Oil glands. Oil glands to lubricate this area so that this area is moist and is not dry. Anytime we have in the skin, this is like this. We have glands like this. So here will be oil, right? So that this area remains soft, moist, and not dry. Lots of here, and we have lots of on the face here, right? So what happens is, when we are young, so we have lots of infection happens. Same can happen here. This place is also very, very prone to acne kind of thing, right? So what happens is we are sitting continuously. There is a pressure here. Okay. So what happens is, if there is an infection by chance here, like we have on the face, which can be very, very normal, it can be on our hands or on our anywhere wherever glands are there. It can, many people have, here also. So if it is a normal irritation, inflammation of the gland, this gland gets blocked very easily because of the pressure. So now there is no escape. Like on our face, it can come out. But here, because of the pressure, mostly it doesn't come out. So what happens is that it becomes collecting here. Yeah, inside. And we feel little bit itchy, or little bit we feel like there is a knot, but we do not feel much. Because fat cell does not have nerves also, not too many nerves, not too much blood vessels. So sensation is little less. Okay. So this start collecting here. Okay. And then instead of coming out from here, it can come out here. It's so easy for it. It's so easy, right? So, and this is a very, very common condition. We call it fistula. Very common, and in people who have fistula problem, it keeps on. Anal fistula. Yeah. How you can say in Japanese, just check. It's a very, very, very common problem, and at least 20 to 30% people suffer from it, particularly the drivers and people who sit long time, or who have bumpy, long standing bumpy. Okay. Got it? The okay. So now, it's very easy for this collection to go instead of coming out from here, because here it is plugged. There is a plug. right? Little bit hard dryness surface becomes here, not easy to come out. So it goes here. This is more easy way. Sometime it may go like in a channels at many places. It opens up. It makes a hole and opens up there. It's a very common condition when we keep on sitting, when we keep on straining, when we have BMP. Okay, so now what happens is you have a channel here, right? This is another new channel here. Okay, new track. So if you are having loose motion, it may come out from here. You have flatus, gas, it may come out from here. Yeah. Okay, wait. Yeah. Not understanding? Let's take it like this. Okay. So now there is a track. Okay. This opened here. It becomes a track now. Okay. This track now is very difficult to treat. Why? You give antibiotics, it will not treat because there is continuous infection. There is continuous infection here. Okay. So 101% antibiotics cannot help. Right? So what is the next way? Next way is to remove it. Complete track you have to remove. Even if little track will remain inside, it can happen again whenever you have BMP, whenever you are sitting long time, whenever there is an inflammation in the body, it can happen again. And these cases, anal fistula cases, you will see people 10 times operation. Very common, very common. That one time operation fail, second time operation, third time operation. We have cases who were treated for 10 times, particularly alcoholics, people who eat lots of meat, and drivers, low social economy group, and drivers, lots of problems. So now what is the treatment? They take out a chunk of piece, remove, cut. This is a very difficult treatment because you have to cut down lots of muscles. You have to cut down anal sphincter. See, here is the sphincter, which open up, close, open up, close. When you cut it down, the elasticity becomes loose also. That you do not have that good control, little bit loose motion, and you don't have any control. So that is one complication, that the anal sphincter become loose or hypertonus, and there is a scarred tissue here, and wherever there is a scar tissue, adjoining tissue becomes weak, because here it is like, so here the skin is stretched. Okay, this is fine, this is united, but here and here, weak tissues. It can rupture from here, right? So, and to take out a big piece, it's a 45 days, no sitting long time. You cannot drive. You can go home after 10 days, stay in the hospital, but you cannot sit down long time. You cannot drive long time. There are restrictions till you heal completely. This is the, these days, what they do, that they do. Lots of money is involved. You are hospitalized. You are 10 days in the hospital, and then relapse chances 101%. Maximum of the people will come back. right? This is the situation of the modern medicine. Now, I tell you, this is one operation we still have in Ayurveda, which was written in Sushru Samhita. I don't know how it stayed there because lots of other operations we missed. We don't have anything to show what it is. Now, what we do in Ayurveda, I will tell you that, and you will be so surprised that one approach is like, give me this is a, suppose this is a thing. I don't know what is there. Like a child, I take a knife and cut down and see inside. Right? And I destroy and then I say, oh my God, it's finished, but I saw what is inside. Another approach can be more like I use my mind. I see, oh, she was working like that. So maybe there is a screen inside. There are some buttons inside. I saw working, and there might be some machinery, which is very complicated, you know? And I used my mind and I just a little bit, I said, okay, let me just try to see from here or there, you know, a different approach. So in Ayurveda, what we do, now what we have to do first, this is the passage. This is the passage, okay? This passage cannot be healed because of continuous contamination. Continuous contamination cannot be healed. Infection cannot stop. And second thing is that there can be a blockage. That pus becomes solidified here and there and it can block. So challenge, what is the challenge? Challenge is, one is infection and other is block. If we can check the infection, if we can check the blockage, it will be so easy to treat this case, right? So what in Ayurveda Acharya Sushruta did, he took a thread, okay, a thread. He took a thread. Dip it in there is a tree, the milk of that tree. He dipped it in milk of the tree, take it out, put it in turmeric, make it dry, put it in the milk again, let it dry, put in milk, let it dry 21 times. And this thread is now coated with the thing. Okay. This milk has a property of cutting. This milk can cut down. And this milk is very irritating. It just makes you, if it is in mouth, so it will make my saliva very wet and very soft. And turmeric is anti-infection, and you know. So what he did, he put this thread from here, take it out from here and tied. So this we do now also. What we do is, we take out the patient, put a probe, put a soft probe with thread on it, take it out and tie. Okay. So this, of course, we do it under anesthesia now. We put an injection first. And if it is very, very high, so this is the sphincter here. This is the sphincter, okay? We have to save the sphincter also. Main is to save sphincter, right? Like this cut is very bad. You have an elastic. You cut it like this, very, very bad. But this elastic, if I keep on cutting like slowly, it keeps on healing. Slowly, it keeps on healing. Slowly, it keeps on healing. And I come out from here and it's already healed. So this thread will work now multiple ways. It will keep on cutting down, coming down, coming down, and it is out from the sphincter. Right? And these tracks keep on getting shorter. We save the sphincter clearly. It just keep on coming, back side is healing. Why? Because one is that thread is moving. So there is no blockage. We treated the blockage. Thread is there, and we ask the patient every time defecation, you go to toilet, sit in the warm water, take a sitz bath for 5 minutes and rotate that thread. So by himself, yes, this is thread here, just little rotate, little bit. It's easy, just you have to take out. Yeah, little bit. Yes, little bit you can take, you can hold this knot and little bit rotate. So just like, but just little movement, not like you will do a complete circle. It is not possible, just little bit movement. Okay, so what will happen is that this will keep open always, and there is a healing material on the thread which will keep this thread, this track very clean and healthy tissue, no granulation, healthy tissue formation. So the tissue will be healthy, and slowly once it is out of sphincter is clear, totally clear, we can just cut it and take it out. The flesh we can cut easily, that will heal, no problem. Sometimes it comes out by itself, but we have to, we just take care of this sphincter. It should come out from the sphincter slowly. So in my practice, 10 centimeter, if the length of the thread is 10 centimeter. So I have seen in 1 week time, it will move approximately 1 centimeter. In 1 week time, 1 centimeter cut will be there. And you don't need a hospitalization. You are treated in the OPD. Just some of my female patients come by themselves from the office. First sitting can be little painful because we have to put the probe inside to see. But later on, to change the thread, I just attach the new thread here and pull it out. So few of my female patients, they just come in lunchtime, and within half an hour, they can go back. We just, we don't give any injection also, just push the new thread. Every week we put the new thread because the medicine becomes weak. This medicine which we coated on the thread, so every time we push the new thread with the new medicine coating, and every week we change. So once the thread is at a comfortable position, that sphincter is saved. It is very, very down. We just cut the skin and remove it. So we treat it like that. No painkillers, no antibiotics, nothing. No, I have not given. Anesthesia for the time of probing. Little bit we just give local anesthesia, not like, not in the spinal cord, nothing, no. Just on the skin, we give little bit of injection, and on the probe we apply. That's it. And see this kind of approach, so different approach, so different. Means everybody knows that this cannot be treated, so they take out the tract completely, because there is no way you can treat it. So in Ayurveda, we do like that. And now some of Indian hospitals for the last 10 years, they also started doing thread method, applying antibiotics on the thread. But we still do traditionally. We still do with the Shar Sutra, we still do with the turmeric coatings. And we never give any antibiotic to any of our patients. Only we just ask them to eat less meat so that your stomach is more clear, clean, no chances of infection, less spices, less alcohol. So these kind of things we tell them. Do we have more vegetable, more salads, more healthy food? So that was the surgery we will be doing in Ayurveda. So just think that if all the surgeries would have been there, I don't know how their approach will be, because that's just out of the box. So we do not know what kind of approach they will be having for other things. Okay, and now I will just show you a little video. Will be one thing I will show you. That's very interesting. You will like it. Any questions so far?